want to get a good feeling of the way we normally do is through a colonoscopy. Now, colonoscopies are covered by insurance, so any insurance that you have, patients don't pay anything for it. So if you have nothing in the industry or other medical conditions, then you should start getting screened at the age of 35 until you're about 75%.
Okay. So Dr. Rojas, I'm going to go ahead and try to translate what you just said. You might have to help me along the way. Ça, Dr. Rojas dice, di cosa colon cancer c'est une plus grande cause de cancer. So, réellement, il recommandé que nous cause de cancer et death et la mort. I'm not sure if I got all that, but I think, okay, thank you. Thank you, Dr. Rimsky. All right, so we're going to go ahead into nutrition. It's so beautiful how we're going to look at the body as a whole today. So we're going to go into nutrition with Jeremy Etienne. Your first question is, what are the key components of health and healthy diet? And how can I incorporate them into my life? You know, talking about the heart, talking about the colon. So we think all of those things come together. So how can you help us?
So key components. So you want, there's certain things that you want in your diet. So le wap manger, le wap chercher un bagay pour manger, ou mettre un bagay dans bouche parce que c'est pas seulement manger, ou faut que boire un bagay as well. So faut que pense de kick bagay. So one thing you think about, you want to think about water. That's like first and foremost. Faut que nous boire de l'eau. Like that's necessary. Everyone needs water. And then also you want to think about how many calories that you're taking in. Because everyone needs a certain amount of calories. The amount of food that Rose may take in may not be the amount of food that I take in. So gain on quantité or no, gain on amount. I don't know how we'll say
Yeah,
amount.
quantité.
Amount, quantité manger ou besoin manger. Ça, on gentifie qu'à manger, by on même bagage on grand monde qui a manger. So faut qu'on connaisse combien manger ou besoin manger chaque jour. So that's how many things. That's another thing you need to think about. Après ça, qui qualité manger besoin manger. So tout le monde besoin végétal, tout le monde besoin manger fruits. You need fruits and vegetables. That's why we need balance. So chaque jour le ou lever ou a ba ou question, la pensée des questions. Si me boire de l'eau aujourd'hui, that's on that. Si me manger en qualité fruits aujourd'hui, si me manger en figue, si me manger en strawberry ou en grape, you know. Et puis après ça, si on manger en poule, après ça on va manger, on va penser, si me manger en végétable aujourd'hui, so what type of vegetables? Si me manger en carotte, et puis quelle qualité végétable. Et là où à manger ou à garder des couleurs. Parce que chaque fois on mange, si on mange tout bagage qui est blanc et puis marron, les bagages ou bagage couleur non manger qui so ouvert bagage qui vert, bagage qui orange, bagage qui rouge, you know, so le wa manger. So you want to mix up your colors when you're eating. Mix up your palette. Find different colors: red, green, orange, white. Not just your food shouldn't just be white and brown. So après ça, ou besoin bagay yo di bagay ça c'est gros manger, like big people food. So chicken, you know, chicken c'est on bagay besoin manger. Poisson, la foie, so un bon bagay chaque monde besoin manger. Quelques fois me dit moun si vous avez chance ou ka manger foie chaque semaine ou si vous pouvez manger en foie chaque 2 semaines, that's good too. So these are the things you want to think about when you're eating. Yes.
Thank you so much. Thank you so much. Our nutrition is beautiful, beautiful. Nous t'as supposé à point note. Don't forget to take notes because, you know, there's a percentage of things you hear that you remember. There's a percentage that you write you remember. So go ahead and take your notes. That was beautiful. Thank you, brother. All right, so we're going to go ahead and to Dr. Cassandra Bellflair Jules. What are the benefits of preventive care, and how can I prioritize it in my healthcare routine?
Preventative care, the benefit is you get to find out what's wrong with you at an earlier stage. A lot of things are preventable, such as if you have breast cancer, for example. If you go to the doctor, they can manage that before. So, c'est pour nous aller checker docteur nous, pas attendre c'est là nous sentir un symptôme, mais c'est pour nous toujours checker docteur nous parce que plus bonne yo joindre maladie, c'est plus bonne yo ka traiter.
Amen. Short and sweet. I like that. Thank you, Cassandra. Okay, so our physical therapist, Dr. Sabrina Joseph, Cherilise, what are some common injuries or conditions that physical therapists treat in children and in the aging population nowadays?
Thank you. That's an excellent question, Rose. I'm also happy and privileged to be here and to share information with you. So common injuries, you said pediatrics, so let's go over that. A lot of times the pediatric population is coming in for behavioral and delayed symptoms, including things like if they have cerebral palsy, autism, and if they're having difficulty with fine motor coordination and being able to move. So pour ti moun yo, pi fort ti moun yo ki vini pou faire physical therapy, c'est parce que yo gen on quelques delay, peut-être yo te gen autism, cerebral palsy, on bagay ki empêche yo faire mouvement bien. Yo pa ka marcher bien, so yo kon vin nan therapy pour yo ka recevoir exercice que nous montre pas seulement ti moun nan mais famille. Si yo vini avec maman, avec papa, nous montre yo ça yo gen pour faire avec yo. So ça c'est plus fort raison que ti moun kon vin nan physical therapy. You said the geriatric population?
Yes, also
Okay, so
geriatric.
pour moun ki gen l'âge, plus fort bagay yo vini, nous on pile stroke, plus fort, douleur nan ceinture, arthritis, so ça c'est arthritis, so les os yo commencé à changer, kounya ou senti douleur dans genou, dans pointe, dans ceinture. Pile nan ça yo raison yo vini, c'est parce que avec l'âge, avec temps, avec fait travail dit, qu'on a commencé décomposer, il pas même genre encore. So laisse ça dans grand monde, dans l'âge grand monde, c'est laisse ça dit oh, me senti ça. Yeah, and en pile dans ça, c'est si ou pas de point précaution pour prendre soin de tête ou bien, right? And ou fait n'importe bagay avec quoi, you end up paying for it later. So en pile fois, moun ap vini yo di, yeah, m'te gen douleur ça pour 10 ans, et c'est qu'on y a m'a vin fait un bagay. And it's hard to address 10 years of low back pain. But for the aging population, majority of the things they come in include like low back pain, things related to arthritis, and then stroke is a big one. Pi fort moun ki gen l'âge, nou traite yo pour stroke.
Okay. Thank you so much, Dr. Sabrina. All right, we're going to go ahead on to Myrna Flurmy. Okay. So Myrna, what is the current trend that is problematic? And since we're in Breast Cancer Awareness Month, October, what is the problematic trend in breast cancer nowadays?
OK, good morning. OK, bonjour tout le monde. Moi, très content là avec nous matin pour me partager un peu d'informations. Question que les madame qui ça m'a poué qu'on y a dans cause de cancer dans sein. Dans pratique moi, c'est ça moi fait comme pratique. On bagaille que nous ouais cap privé plus souvent que les nous-mêmes moun noirs African American haïtien moun qui sorti dans Caribbean yo les yo joine diagnostic cancer dans sein n'a découvert ça dans un stage qui plus avancé et puis nous ouais ça son problème lié pour communauté parce que cancer vini il commencé à stage 0 jusqu'à stage 4. Les nous joignent cancer dans stage qui plus bonheur, stage 0 à stage 2, nous avons plus chance pour nous joindre traitement qui éradique le cancer totalement et pour qu'on continue la vie sans problème. Mais lors découvrir cancer dans stage qui plus avancé, stage 3, stage 4, ça veut dire que le cancer a déjà ravassé et puis là attaqué l'autre partie corps. Laisse ça traitement pas pas qu'à éradiquer cancer. On seul bagay li ka bo soulagement pour qu'à réduire douleur, pour qu'à réduire affect que li fait dans toute partie corps. So ça n'a pas dans communauté haïtienne moun noir, les nous découvrir cancer li déjà dans stage qui avancé parce que Jean docteur a dit nous pas fait prévention, nous pas checker docteur souvent, nous pas fait check ça yo pour nous ka découvrir dans stage qui puis bonheur. Les nous découvrir dans le ouais docteur, c'est les nous commencer sentir douleur. Et puis encore, depuis qu'on commence à sentir douleur, ça veut dire que la commence à affecter le corps, il est déjà avancé. So, c'est peut-être ça, nous supposons aller docteur, c'est pas les nous avons douleur seulement, mais régulièrement, Jean-Docteur a dit pour nous, parce que si on a un problème, nous avons découvert ça bonheur, so, plus bonheur que c'est grand matin, et puis nous avons plus de chance pour nous aider nous.
Thank you so much. Yes. Nous d'accord? Yes. Ultimate? Oh, okay. You guys are here. All right, so we're going to move on to marriage and family, our marriage and family therapist. Remember, Ultimate Health, the whole body, everything about you, ties into health. So, Asmandi Jean, what are some common relationship issues that couples face, and how can therapy help, alleviate some of the stress that can cause some of the diseases that we're trying to prevent?
I see you went for the heavy hitter.
Yeah.
Hi, everyone. It is a pleasure to be here. Son plaisir pour me parler avec nous, pour nous parler sur mental health. Son bagay qui affecte mon en pile. So, ma go between both languages.
Okay, thank you.
So for people that are facing issues within their relationships, so when you get into a relationship with someone, or when two people become one, or let deux moun vin maye, on bagay moun pa tellement penser avec, moun sa pouè tout parti nou. Ya pouè sa moun pa wè deyo. So whoever you marry will see all the versions of you. Not the versions that you put out in front of your boss, your colleagues, your friends. So what usually happens is sometimes our partner may trigger us. Partner, gene fwa mounou maye, I kon fò fâché, gene le ou fò manger, ou fin bouike, li vini, I di, manger an ti fouet. Kounya I fò fâché. Kounya wap chita, wap reflechi, and then what happens is, it starts to impact you mentally. So mentalement, si moun nan chaque fois ou fè manger, I vini. An pi apre sa, I di, mesye, manger a man konti sel, mesye, like, kounya I vin meton nou problem ou frustre. Mais problème là qui vient gagner fois moun qui maye yo pas chita ensemble pour yo faire dialogue, yo pas connaît qui gens pour yo parler. En pile haïtien, moi-même moun moi oui, mais en pile haïtien, c'est pas un bagage qui naturel pour nous chita pour nous dire moins d'amour. Ou pour nous chita pour nous dire me senti me fâché, ou pour nous chita pour nous dire j'ente dim ça pas tellement remen j'en dim nan oui, so ça qui vient arriver, il vient faire des monde qui rete ensemble, qui maye, mais yo getan divorcé. Parce que yo pas kon qui gens pour yo parler avec une avec l'autre. So là vini into therapy, ça nous travaille avec, et pour moto qui gens pour dire chérie, me fait 3 ans d'ap fait illegim ça, sou elman konti sel fin manger, mande comment journée mieux, en puis après ça, pita wa di moi, mais ton ti sel, mais l'o vini nan pot la di manque sel, son problème pour moi. Mais sou pas apprendre qui gens pour dialoguer, pour parler avec chez, on pas avec mauvais gens non parce que ça vient affecter santé parce que ça haïtien pas comprendre, nous dit comme ça sont nous forts, nous capables, mais tout ça la build up. So it's building up. Quand y a tension à monter, si quoi monter, en plus ça seulement tu besoin qui gens pour dialoguer. So quand monde qui travaille avec couple, moi aider yo pour yo ka apprendre qui gens pour yo parler with one another.
All right, Ultimate. All right, I seen a lot of heads shaking. I seen a lot of people agreeing because listen, marriage is no joke. Thank you so much. All right, Amanda Jean, you're hot. Okay. All right, we're going to go ahead and go on to OB. Talking about marriage, yes. Huh? Oh, anti-anglais? Oh, okay. You went all okay. We have a few English speakers, but I appreciate your Creole. believe me.
Okay. So basically, what I was saying is that a lot of couples come into therapy because they struggle with communication, and our partners can be triggers for us. And it's not because they're intentionally doing it, but it's because they see all versions of us, right? And it's not easy to always be regulated. So what we work on with couples in therapy is learning to communicate the feelings, the things that you're experiencing. So the example that I gave is a wife that's always cooking, right? And her husband comes and like, oh, the food is too cold, or it's missing salt, or it's whatever, and it puts the wife in a place of frustration. But instead of communicating that, she allows it to build up. And when it builds up, that's when we start to see the symptoms that people are going through: racing thoughts, feeling overwhelmed, feeling anxious, feeling like their partner is against them. So when we come into couples therapy, we teach them, I'm gonna do the English version, like I feel statements. So instead of saying like, hey, your food's not good, get it together, like I feel that, the wife would communicate to her spouse, I feel like when you come in and you directly attack my cooking, it puts me in a place of frustration. It puts me in a place of feeling down because I spent 3-4 hours preparing this meal for you. I would prefer if when you come in, we talk about our day, and then later on, you communicate it to me. So we work on communication, how to communicate to your partner so that way your partner is able to receive it, and so forth. That's the... Yeah.
Awesome. Thank you for that translation, even better in English. Okay. All right, let's go to our OB gynecology. Dr. Sophia George. Dr. Sophia George, questions we have for you as we speak about marriage, and we have women here. What are some of the most common types of gynecological, we're going to go into gynecological cancer, and how can we reduce our risk? I think Renelle spoke a little bit about it, but we can.
Bonjour tout le monde. So, moi qui parle anglais, moi je peux pas haïtien, moi c'est Dominicain, mais créole moi c'est pas bien, très bien. Okay.
It's beautiful.
Okay, so I'm a molecular geneticist in the Division of Gyne-Oncology, and we study gynecologic cancers. Currently, the most common gynecologic cancers being diagnosed now is uterine cancer, cancer of the uterus. And then the second most common is cervical cancer, which is caused by HPV. So what are the things you can do to protect yourself? One, for uterine cancer, I should also say that the most aggressive kind is diagnosed in Black women. And actually, one of the things that we've noticed is that Haitian women have the highest proportion of that aggressive kind in South Florida. We've done this work for a while, and actually now we're actively trying to understand what are the drivers behind that. So protect yourself. One is, we've heard it already, diet, exercise. So some of these cancers are driven by hormones. One thing about endometrial cancer, uterine cancer, is it's most common once we stop having our period, our menstruation. So for women that stop having their period, if you start having your period again, you need to see the doctor, okay? If you stop having your period and it starts again, please go see the doctor. That's one of the signs. And that's one of the signs for many gynecologic cancers. For cervical cancer, it's HPV and having your pap test regularly. Again, prevention, we've talked about it already. So prevention, and early screening.
Okay, thank you. Thank you so much. Okay, so we're going to go ahead and go back to Dr. Rimsky-Dennis. Ultimate? Okay. What are the symptoms of a heart attack, and what should I do if I experience symptoms?
That's a very good question. So the symptoms of a heart attack include chest pain or chest discomfort, shortness of breath, diaphoresis or sweating. Sometimes you can have lightheadedness or dizziness. Sometimes you can have generalized malaise. So symptômes que yon moun a fait une crise cardiaque, c'est douleur l'estomac, Gen des fois moun kon gen souffle coûte. Gen des fois moun kon gen vertige ou bien moun kon sentir tout dit. Gen des fois moun kon gen un malaise, il pas sentir bien. Tous les symptômes ça aussi symptômes que yon moun a souffre une crise cardiaque. Et gen des fois tout surtout avec filles et moun qui diabète, moun qui souffre sucre. Yo pas qu'on gagne des symptômes comme ça. Il y a des fois symptômes qui yo qu'on gagne c'est un petit reflux ou bien un petit acide ou bien un petit gaz. C'est pour raison ça n'importe symptôme que vous senti surtout c'est un symptôme qui pas normal et bien ou bien un symptôme que vous pas qu'on gagne à la caille un docteur. Yo monde qui a souffert une crise cardiaque c'est un emergency medical, c'est un medical emergency. So it's important to also note that women and diabetics may sometimes not present in the very typical fashion as chest pain, shortness of breath, or diaphoresis and things of that nature. Sometimes malaise or reflux or just feeling unwell, right, can be the symptoms of a heart attack. And a heart attack is a medical emergency. So if you're having these symptoms, it's very important that you seek care and seek treatment from a medical professional as soon as possible.
Okay. Did you guys understand? Est-ce que nous comprenons? What is it? It's a medical emergency. If that didn't say it, I don't know what else would. Okay, Dr. Rimsky, thank you so much. Yes, definitely, a medical emergency is 911. Pa chita, pa dormi, pa penser. Just go. If there is any doubt, if you have a choice to make, should I go to the hospital, should I not? You always go. You always err on the side of precaution. You always go for safety first. Whatever is best, that's what we do. All right, ultimate? Yeah. All right, so let's go back to Dr. Maria Rojas. Dr. Maria Rojas, what is fecal incontinence? What is that and what does it look like? Probably in the older population, maybe? Yeah.
You're a tough act to follow, by the way.
I know. I was thinking the same.
Jeez, I need to step it up a little bit. So fecal incontinence is just kind of a fancy wording for leaking of your stool that you can't control, okay? And leaking of the stool doesn't necessarily mean that you're having a large amount of stool in your underwear. It can be gas, it can just be a smear, and it tends to happen in older patients and women actually who've had kids because the pelvis, the muscles in the pelvis are not working as well. And so it's important to note that there's about an estimated 1 million people in this country with fecal incontinence, but there's probably a lot more than that. It's just that people don't like to talk about it. Nobody wants to tell their doctor that this is happening because they think that, oh, I'm just getting older, it happens. And it's important to know that that's not true. There's things that we can do for this because it does affect people, mental health, quality of life. Some patients don't want to leave the house because they're afraid of having an accident. And so that's something that we can treat. And as a colorectal surgeon, I treat very often.
Okay, awesome. Okay, this is very challenging for me today. Dr. Rojas dit comme ça qu'il y a un problème de la fecal incontinence. Sa fecal incontinence, c'est l'air comme si ou pas toilette sous mais comme si l'eau toilette la tombe sous. L'eau est dans badum ou senti l'eau toilette a tomber sous. Ça relève fecal incontinence. Ça veut dire gon partie dans corps ma muscle la pas travail j'ai ta supposé travail. So ça veut dire ou pas besoin perdre ça ou pas besoin comme si timide pour aller au docteur pour dire docteur OK ou gen un problème que toilette pas ou pas ka kembe toilette la tomber sous. Et ça docteur Rojas fait docteur Rojas lui-même li corriger problème ça. So you get doctor pour ça pour corriger problème là. Am I okay? All right. Awesome. Ultimate? Yeah. All right. Thank you, Dr. Rojas. All right, so we're going to go ahead to physical therapy, Dr. Sabrina Joseph. What are some measures we should take to prevent falls? Speaking about the aging population, what are some measures we can take to prevent?
Again, excellent question. Là, commencer dans l'âge, là, tomber, c'est pas même genre si t'es un petit moun tomber. Petit moun qui a tombé, fini, whoop, they keep going. Là, commencer dans l'âge, tomber, il a même tiré. Right? Ou ka imagine ou tomber ou craser un zo, kounya ou gen pour faire hip replacement, and there's a high mortality rate. After you have a hip replacement, 50% of them die within a year. So craser zo c'est pas un bagay qui ti piti. So ou pas vle rive nan point que ou ap craser zo. Ou vle pour tout faire tout effort pour pas quitter corps tomber. So premier bagay pour pas quitter corps tomber c'est corps gen pour gen assez force. Raison ou te tomber c'est parce que vion yo pas react fast enough to prevent the fall. If I'm gonna fall, I take a step to prevent the fall. Mais si m faible, m'pa ka même faire pas ça and then boom mate. Right? So premier bagay is to stay healthy and have strong muscles, especially your quadricep muscle. Gen yon gros viande qui la nan pied ou, right? C'est ça qui aide au camper, ça qui aide au marcher. Si viande ça faible, ou gen plus gros chance pour tomber. L'autre bagay qui ka faire tomber, c'est just being more safe. Ou gen pour garder nan kay. Est-ce que ou gen un mat, un rug qui pas doué là, right? So peut-être move it. Parce que l'on leve nan nuit pour aller dans bateau, mat ça là, ou pas wel bien, et boum, ou tomber. Pour exemple, si vous avez levé dans nuit pour aller dans bateau, faites sûr que vous avez assez de lumière. Maybe like a little night light pour qu'on voit bien. And then vous avez pour faire attention avec le remède que vous prenez. Parce que quelquefois, le remède qu'on prend qu'à faire sentir tout dit, right? Et so là, on connaît, OK, ma prend remède ça faire, pour que si on agit avec corps. Un autre bagay qui me fait avec patient qui a un problème ou grosse chance pour tomber, nous travaillons pour qu'il y ait un plus balance. So, on fait un exercice que on fait un challenge your balance, right? Parce que si vous balance ou bas en pile, donc seulement façon pour faire balance la montée, c'est mettre le corps dans une position que vous avez pour react, right? So, l'arrivée ou connaît ça ou bien pour faire et là commencer ouais que vous avez un problème avec balance avec tomber ou bien pour aller au docteur et finir là pour demander pour une prescription aller your physical therapist parce que tomber c'est un bagage qui qu'on arrive bagage j'aime dire oh si vous faites tout ça ou pas jamais tomber parce que il y a plusieurs raisons pour tomber so nous montrer pour descendre chance pour tomber nous ca montrer tout après tomber j'en doit camper ça c'est un bagage qui est important.
Awesome, awesome. Thank you so much, Dr. Sabrina. Okay, we're going to go ahead to Manera Fleury. Our next question for you is, what are some common side effects of cancer treatment, and how can patients manage the side effects?
Good, very good question. I'll say it in English and then I'll try to bring this. So, traitement cancer, c'est pas un bagage qui est facile en pile. C'est peut-être ça que des fois il est difficile en pile pour prendre décision pour commencer le traitement. Il y a plusieurs sortes de traitements. Il y a des cancers que vous êtes capable de faire juste opération ou pas besoin de chimiothérapie. Il y a des traitements, c'est radiation ou bien il y a des fois on prend chimiothérapie, c'est remède qui travaille dans tout le système. Radiation bon et side effect. Et puis chimiothérapie un bon side effect. Side effect qui plus souvent parce que c'est un remède qui travaille dans tout le système qui marche dans le système pour tuer cancer et puis il y a des remèdes qui relèvent immunothérapie qui travaille avec le système parce que quand il y a un système qui combat maladie tout immunothérapie travaille à ce système pour et joindre n'importe spécifique cancer dans le corps pour aider continuer pour tuer cancer ça yo après traitement fini. So yo tout gain side effect, ça plus commun c'est fatigue. L'on prend chimiothérapie traitement cancer ou fatigué en pile, des fois pas même sentir ou ka lever dans carbone même, très difficile tout corps bas. Ça on ka fait pour combattre fatigue là ou prend repos, logé pour repos, mais believe it or not c'est plus rester as active ou capable ou active. Lever fait marcher. Des fois au cas lever dans matin on pas senti ou voulez lever du tout, mais le plus important pour lever saute dans carbone nan fait marcher, ça aide corps combattre fatigue là. On l'autre et side effect nausea ou sentir cœur plein, appétit ou bas, ou pas sentir ou voulez manger, ou pas sentir ou voulez boire rien, mais il est nécessaire pour continuer manger, pour continuer et boire de l'eau pour gagner liquide parce que pour flush tout chimical qui dans le système ou pour aider ou besoin de nutriments tout parce que on remède qui passer dans tout le système là faut balle énergie tout so faut manger so l'organe qui plan gain argent nous toujours bypasser un remède pour aider yo avec nausée. OK, mais il est très important pour parler à docteur alors à besoin traitement cancer qui sont senti pour yo ka aider yo avec symptômes ça yo pour ka continuer traitement parce que c'est traitement qui là pour aider yo, li pas un bon bagay pour suspendre traitement parce que au senti effet secondaire ça yo. Il y a des fois là où joindre traitement ou gain plus chance pour joindre infection parce que le système immune descend ou gain fatigue et pour gain plus risque ou ka saigner. Tous les symptômes ça yo nous expect yo lo a joindre traitement. So nous toujours docteur a toujours gain bagay que yo ka faire remède que yo ka faire qui pour combattre ça yo parce que si white blood cell ou descend en pile, yo ka bon on remède tant que nous projet qui aider corps faire plus pour ka aider combattre infection avec l'autre bagay que yo ka exposé. Traitement qu'on perd des cheveux, mais ces cheveux seulement et le fin traitement yo ka grandi back et puis grand paquet belle perruque dans la rien so ou ka still al craser zone même si ou perd des cheveux ça ça c'est pas un gros problème. OK ou ka gen changement dans peau ou faut toujours kebe environnement côté très clean parce que ou ka joindre infection facile pas exposé à trop soleil parce que rebelle affecter toute bagaille ça yo parce que ça le fait li marcher dans tout système au tête au pied pour éradiquer cancer à n'importe côté lié en même temps li affecter bon cellules qui dans corps yo tout c'est peut-être ça un symptôme ça yo mais de pour parler à docteur ou dire mais ça me senti il y a toujours une solution qui est d'eau avec tout effet secondaire yo juste communication que ça plus important.
Thank you so much. Yes, yes. We are satisfied. Ultimate? Ultimate health. Thank you. Okay, so we're going to go back to marriage and family. Okay, Amanda. Who said whoosh? Oh my God, yeah, that's the hot spot over there. I don't know. Okay, so what are some strategies for building and maintaining a strong emotional connection in a relationship? The reason why we're talking about relationships in the health fair is because we realize that relationships do, correlate with health. Depending on how happy or stressed you are, your health is on the line. So go ahead, Doc.
That is very true. So you're whoever you marry or mounou maya c'est moun qui fait plus affaire sou que maman, que papa, que zami. So c'est très très important que Jean te entre dans mariage là qu'on continue li. L'autre pas là moun nan ou mande chéri on a la movie on a le cinéma ou mène la manger ou fait toute bagay ça pour cultiver relation en puis fait qu'elle content. Les qu'elle content y aider au passer stress la descend. En puis le stress la descend y aider que au à progresser dans vie. So when you first started dating your partner, you guys went to the movies, you went out to eat, you guys do all of these great things, and you always hear some people say that when they get into a relationship, there's happy weight, and it's because you're happy. The person brings out the joy in you. But the problem becomes is a lot of people, when they get married, they stop putting in the work in their relationship. Whatever you don't cultivate, whatever you don't feed, it dies. So what happens is now the partner starts to see the bad sides of you. And the problem with that is it impacts your mental health. Now you're anxious, you're depressed, you're questioning your worth, you're questioning your value. And one of the biggest things people don't realize is loving maye, or when you get married, is that when you add kids into the picture, it is now something that you are introducing into this relationship that was a non-factor. Kids take up a lot of space. We love them. They are blessings. But it is important that you are cultivating your relationship. You are setting dates. The person you married is not who you're going to have 10 years from now. Mounou maye, c'est pas mounou pal gen 10 ans, 20 ans de ça. Tout temps a changé. En puis les moun lovin fait ti moun sa changé, il pas même gens. Énergie de gen kounya c'est ou même plus ti moun nan. Ça pointe l'autre la pointe. You know what I'm saying? So it's très très important pour nous make sure. It's très très important pour nous make sure que nous prend soin mariage nous. Même gens qu'on a dans le cinéma, al marché. Mandel comment liye, mandel comment santé liye. The same way you came into the marriage is the same way you have to fight to keep it 10, 20, 30, 40 years from now. And if you're struggling to do that, because we live in the world, it's not easy. Come to couples therapy. We help to reignite that spark. We help you guys to work it out. Vini nan thérapie avec madame ou avec monsieur ou, pour nous ka travailler ensemble pour ka mette di fè ça encore.
All right, Ms. Jean. Oh, okay. There's a request for you to translate a little bit of that in English. All right.
No. I didn't say nothing break. Oh, the breastfeeding. Okay, so what I said is.
I think that's what they talk about.
No.
Okay. Okay,
No. I didn't.
Okay.
No, I said,
All right,
so
all right.
what happens is when we introduce kids, right? So the woman's body goes through changes. So now she may be breastfeeding the baby, which was previously for your partner, right? So now it becomes a fight. So it's important to understand how to cultivate the relationship that you're still giving the desires relationship-wise that you and your partner. No cousin. No cousin. We're not breaking nothing. It's important for you to still build the intimacy with your partner sexually, as well as it is important for you to understand that your partner is now a mother as well. So what I said is that it's important. That's one of the reasons why we're here, is sometimes that's hard to transition to balance being a mother, an entrepreneur, or a career woman, or, to be, a provider, a husband, and then to have kids. So it's important for, coming to a therapist that we can help you through those transitions and to keep your relationship going. Okay.
All right. Ultimate? Yeah. All right, take notes, guys. All right, so we're going to go ahead to Dr. Sophia George. For young adults, can you speak on the HPV vaccine pros and cons?
So I would say I don't know of any cons, quite frankly. I also would say that I am vaccinated. My entire family is vaccinated against HPV because we know that HPV causes cervical cancer, head and neck cancer, anal cancer, vulva cancer, cancer of the vagina, penile cancer, so cancer of the penis. It is important that we protect ourselves. Kids from the age of, I think, 10 or 11, all the way up to 45 years old. I don't know of any cons. There's lots of pros, which is prevention. Prevention, and that's what that vaccine is for. It's a safe vaccine. It's been distributed across the world, and actually in a country like Australia, cervical cancer is essentially eliminated. In Africa and the Caribbean, in South Miami, cervical cancer is still a problem because we are under-vaccinated or we don't have access to the vaccine. So it is important that we do it both for boys and girls and women and men.
Okay, awesome. Thank you so much. All right, Dr. Remsky, Dennis. Easy there, because you were a little excited. All right, third question for Dr. Dennis. How can I manage blood pressure and high cholesterol in addition to medication? Qui j'aimerais capable manage tension avec cholestérol, même les médicaments?
Thank you so much. That's a wonderful question, and I think it's even more important in our community. So there are many ways that blood pressure and high cholesterol or hypercholesterolemia can be managed outside of pharmacotherapy. The mainstay is with diet and exercise. Unfortunately, many of the things that we're eating, many of the things that we consume on a regular basis have high quantities of sodium, salt, right? They have high quantities of cholesterol. They have high quantities of saturated fats, right? So the very first thing that we need to do is consume a low salt, low carbohydrate diet. Pour me répondre question bien pour peuple. Ils ont demandé nous qui gens pour nous contrôler tension nous avec cholestérol nous à part des médicaments que un pharmacien ou bien un docteur qui a prescrit. Premièrement, c'est ça n'a manger. Qui en pile dans nous, n'a mettre maggi dans manger yo. Maggi c'est un poison lié. Maggi c'est un diable en personne, c'est un poison qui est lié. Maggi a un pile sel, un pile sodium. Là où prend maggi, là où mettez le dans manger, il vient faire que tension tension vient pas contrôler même les bons médicaments. À partir de aujourd'hui, on pas que personne dans Bethany a continuer à manger maggi, a continuer à mettre maggi dans manger. À partir d'aujourd'hui, quittez ça net, coupez ça sec. Deuxièmement, on sait de manger qu'il a mangé. Manger qui gagne pile carbohydrate, diri. Oui. Nous mangeons trop de diri. Il faut que nous diminuions la quantité de diri que nous mangeons. Je ne vais pas 6 semaines manger non, parce que si nous 6 semaines manger, nous ne pas coûter. Même nous diminuer la quantité de diri que nous mangeons. Diri, ça il fait nous gros. Il fait nous obèses. Il fait nous gros tendance pour nous souffrir sucre. Il fait nous pile tendance pour nous faire crise cardiaque avec stroke. Cherchez éviter manger ça yo. De préférence, manger blé. Manger quinoa et on sait de l'autre manger qui gagne fibre. Manger ça est bon pour tension nous, il y bon pour cholestérol nous et il y bon pour cœur nous. Que bon Dieu continue à bénir nous.
Okay. Pastor Rimsky Dennis. Pastor Rimsky Dennis. Dr. Rimsky Dennis, thank you so much. Awesome. Wow. Okay, Dr. Rojas, you're going to have to follow that again. He's like, why are you doing this to me right behind him? Okay, so Dr. Rojas, what are good bowel habits? Like, kisaki bon habiti toilette. What are good bowel habits?
Yeah, so I mean, I get a lot of patients that come see me because they have constipation, they have bleeding from hemorrhoids, they're having difficulty going to the bathroom, and I think what a lot of people don't realize is that you have to change your habits first to improve those things. So I almost never prescribe anything or do any sort of procedures when the patients first see me. I talk to them about things that need to change for these things to improve. So good bowel habits include, the best diet for the colon is a high fiber diet, for example. We don't get enough fiber in our diet, and it's everybody, the Western diet doesn't have enough fiber in it. I mean, I think you have to eat something like 5 lettuce heads to be able to get enough fiber in your diet. So starting with fiber supplementation, and there's tons of brands out there that you can get because you need anywhere from 26 to 30 grams of fiber per day. So fiber is number one. Drinking a lot of water. And when I say a lot of water, technically you're supposed to drink like 8 glasses of water a day, which is 64 ounces. Because like we said before, water is one of the most important things. The other thing is the amount of time we spend on the toilet, okay? Everybody brings their phone into the bathroom now. iPads, you sit there and you're there for 30 minutes, 40 minutes. That's actually really bad. Okay. Because you're sitting there, you're kind of letting all these blood flow come to the anus, and then that actually makes your hemorrhoids worse. So I always tell patients that you 5 minutes. You sit. If you go, you go. If you don't, you get up and you come back. Okay. And so usually those are the 3 things that I tell patients, and most of them honestly get better just with that. Diet, water. Not sitting on the toilet for more than 5 minutes.
Okay, awesome. Thank you, Dr. Rojas. That's a lot. Oh, translation, yes. Oh, yeah, I forgot about that part. Okay, so Dr. Rojas parlait de qui j'en pour aller dans la toilette, nous t'as supposé aller dans la toilette bien dri. Il dit comme ça, les nous aller dans la toilette, les nous chita, nous pas supposé chita pour longtemps, comme si ou parler dans la toilette là avec téléphone ou avec l'autre bagaille ou appli, les finir chita parce que ça fait l'chita comme si il dit quoi pour la sang descendre. It's so living fait créer un bagay qui est les hemorrhoids, lo fait ça et sou gen hemorrhoid living fait pi mal. So lo ay nan toilette ou ta supposé faire 5 minutes plus. Sou sous toilette là ou pas faire rien, ou ta supposé lever après ça ou vous retourner encore mais pas rete chita à battre pour toilette. What else did I miss? Fiber, okay. On l'autre partie des toilettes bien, pour toilette bien ou doit manger bien. C'est gens ça ou capable ouais qui gens à manger, c'est dans toilette tout. So dès pour manger bien ou ta supposé toilette bien. Gon bagay qui est les fiber, and I think our nutritionist can also elaborate on that. Gon bagay qui est les fiber ou supposé manger les ti bagay légumes bagay sa yo yo edo à les toilettes pi bien. Ou ta supposé manger plus bagay sa yo et yo gen l'autre supplément qui capable edo aller pi bien. Après ça, de l'eau. Thank you guys. My assistants, yeah, you guys are on point. Okay, de l'eau. Ou ta supposé boire en pile de l'eau. You know, we should be drinking like 8 glasses of water a day. So, ta supposé boire en pile de l'eau, ça aide bagay la travail comme si quoi travail la éliminer, ça ta supposé à éliminer. Grand pile moun yo ou mande, est-ce que tu bois de l'eau? Yo bois yon verre de l'eau, that's it. C'est sacré de l'eau. No, ou ta supposé boire plus de l'eau parce que ça, you should be drinking at least 8 glasses of water a day to help your body do what it has to do. Yeah. Anything else? All right. Thank you. Ultimate? All right. Okay, we have Dr. Erin Saintville. I kind of skipped over you a little bit. Don't be trying to hide up there, okay? Okay, Dr. Saintville, I have a question for you for a pediatric dentist. This is our pediatric dentist here. What are the most common oral health issues you see in children? And how can parents prevent that? I think that's one of the areas that's like overlooked in kids, the dental hygiene, the mouth health. So if you can elaborate on that a little for us, please.
Thank you. Thank you, everyone, for having me. So yes, the most common or number one childhood disease that's preventable is dental caries. A lot of people feel that because the baby teeth are going to fall out, oh, we don't have to take care of them, we don't have to brush them, we can eat whatever we want, and that's absolutely not true. So the American Academy of Pediatric Dentistry recommends that a child starts to visit the dentist by 1 year old. And the reason behind that is because we're finding a lot of cavities. So, pile moun pense le yo gen dan bébé yo, li pou al sot lap tombe, nou pa bezwen pou an soin de yo, nou ka manje n'importe bagay nou vle manje. C'est pas vrai, nou vraiment bezwen pou an soin de dan bébé yo. Also, too, the baby teeth is the guide for the adult teeth to come. I have a lot of patients that I have to see in the hospital. Imagine trying to do work on a 2-year-old in a dental office. It's impossible because of the behavior. So now we have to put them under general anesthesia. There are patients that have to extract a lot of teeth due to infection. Children get infection. And I think a lot of the panelists here, it also ties in with dental care because we have those that have infection and that leads to the heart. We have patients infection and it leads to the brain. I've had patients, m'gen patient kote, yo gen tellement gen infection 6 ans, 7 ans, figi yo men grosse. Yo pa ka l'école, parents yo pa ka al travail, so ka imagine nan douleur ti moun sa ap soufri. Gen pil moun ki pa eme al kay dentiste, raison parce que yo konnen nou bay nou piki, nou rache dan, etc. Men le yo komanse pote ti moun nan kay dentiste bonheur, nou etabli fondasyon pou ti moun nan, kote li pa bezwen per al kay dentiste.
Thank you so much, Dr. Saintville. Ooh, she was hiding all those little nuggets. Can I ask you one question, a follow-up question on that, as far as the correlation between mouth health and heart? Can you elaborate a little bit more on that?
Yeah, so it's really from the bacteria. The bacteria, once we have infection, especially around the mandibular area, it could lead to angina. It could just lead to a lot of things that you don't want to see a child undergo. Also, too, correlation with cancer. So one of the side effects with cancer, whether you're an adult or a child, could be xerostomia, where it dries up the mouth. So now you don't have the saliva to protect the teeth, and then you get more caries. And then also there's gingivitis, there's periodontal disease. Periodontal disease is really linked to a lot of people with diabetes and heart condition. So ça fait ça, nous vraiment besoin d'alcaï dentiste 2 fois par année, parce que même gens yo m'ont dit comme ça, là commence à sentir un petit bagay qui pas normal, couille alcaï dentiste, parce que là ça va besoin non chita racher paquet dents, là racher dents, li vinn changer figure. Figure pas même gens, ou après figure descend, ou vinn paraître puis like more age than your actual age. So that's why we really, advocate for good oral health. But yes, it's really the bacteria that affects.
Thank you. Thank you so much. All right. So we're going to go ahead and move on to Sabrina Joseph. How can physical therapy help improve mobility, strength, and function after an injury? I think you talked about that on our last question, after an injury or surgery.
Good question. So I think I have to first define physical activity and physical exercise. So as a physical therapist, especially within our community, we get a lot of misunderstanding. I have patients come in, especially Haitian patients or even just Caribbean, and you ask them how active they are, and they say, yeah, I'm very active. And then you ask them what type of exercise. They kind of look at you like, well, when I clean the house, when I do yard work, that's my exercise. That is not exercise. It's physical activity, but it's not exercise. Exercise is where you dedicate a specific time in which you're challenging your cardiovascular, your heart beat is increasing, you start sweating. It's a purposeful movement and activity to challenge your heart and muscles. So, premier bagay m vle fè nou konnen, gen yon diferans avèk physical exercise and physical activity. An pile fwa, pasyon kon vin wè nou nan physical therapy, yo di, oh, m toujou fè exercise, m ba bezwen sa. En le mwande yo ki sa yo fè, yo di, oh, m fè manje, m netwaye kay, m fè gradien. Sa pa physical exercise, sa se physical activity. Li bon, paske ou gen pou fè aktivite, but li pa physical exercise. Le ou deside ke wap wal fè an exercise, c'est parce que ou prend temps que ou va faire une activité spécifique qui aide avec vion gain plus force pour aider avec care que ou senti que ou bat ou souhait, right? So ça c'est physical exercise. So après on moun fait your injury, right? So peut-être on moun tape marcher fini yo tomber, they sprain their ankle, right? So ça veut dire qu'on y a ou gen douleur, li enfle, ou pas marcher bien sous li, ou ka vin nan therapy, nous ka montrer ou exercice ou ka faire pour aider retourner or restore that strength that was lost. And then après ça nous ka montrer ou jan pour pas quitter ça arriver encore. Peut-être c'est un bagay où te fait mal qui fait gen chance pour tomber fini sprain your ankle. So les nous gen patient qui vini pour n'importe bagay, pas seulement que nous help rehabilitate them pour yo ka retourner restaurer tout ça yo te perdu parce que yo te gen this injury, but nous montrer yo gens pour yo agir avec quoi pour pas quitter ça arriver encore.
Okay, awesome. Thank you. Are you guys satisfied with that answer? No d'accord? Okay, so we're going to go ahead and go back to Mernell. What are some resources available for cancer patients and their loved ones during the time?
Good, very good questions. A lot of times we have the resources right there, but we don't use them. Like this is an amazing health fair with a lot of information and screening, and yet this room is not packed. There are tons and tons of health fairs in the community that I'm invited to, I go to, and it's right in the community, and we don't utilize them to get resources. So you have all of these experts here that you can come in and see for free. This is beneficial for the uninsured, underinsured, and you have access to these experts, but yet a lot of people do not come and take advantage unless they're getting something in hand. This is actually the most precious thing that you can get, is this knowledge to prevent, complications of disease process that we already have, or things to help prevent it. for patients that have cancers, again, these health fairs, you have my organization, and there are other organizations, for example. So I'll talk about the Haitian American Nurses Association of Florida, HANA. We do have an office located in North Miami Beach that we're opened Monday, Thursday, and Friday, and it's all volunteers that's there in the office waiting for people to come in for whatever. If you want to get your blood pressure checked, if you want to get your sugar checked, you don't have the machines. If you were in the hospital, you were discharged. We know how the discharge process works. The nurse comes in, this is your prescription, blah, 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 and go. And then you don't know how to take these medications, what's the appropriate way. You can come in, these resources are there, and ask the nurse, this is my prescriptions, these are the meds. You come with your brown bag with all your medications. You have a volunteering nurse or someone there that will sit with you, look it over, and explain to you, this medication, this is what it's for, and they'll do it in your language and everything else. There's so many other community things out there. So when you come to these health fairs, find out about the person, the organization they serve, and how you can access whatever service that they have to give. And then for cancer, and so, you know, Hannah's there for whatever, diabetes, cholesterol, cancer, mental health, whatever it is. So take advantage, and also you that are here, and if you know friends, family that don't participate or join, encourage them to. So you're also a resource. You gain some knowledge, and then you share it. For cancer patients specifically, there's the American Cancer Society. They have a website. They have things that you can download, information package you can download, you can print out, you can share with loved ones. Sometimes they have them in different languages that you can get. For breast cancer specifically, there's the Florida Breast Cancer Foundation. There's the Susan G. Komen. They have breast cancer walks that are for free. That's happening soon. The next one is October 25th in Broward. The date one already happened on the 4th. So when you see these free things, even if you're not getting something handed to you, some information, some people that you can meet, people that go to these things that volunteer, they want to serve, they want to help, they want to reduce the disparity. So use the resources like this that are available to you in your community. Even if we're not the specialist, we can refer you, we can connect you. So I think these are the best resources, because some of us are not too tech savvy to go to the websites, but use what we have. So
thank you so much,
You're
Mernell.
welcome.
So Mernell dit que les nou gen bagay sa yo, resous sa yo ki disponible pour nous mêmes, pour avantage sou li. Li di, pour exemple, nou gen health fair sa la, nou preske pa gen moun la, pa gen moun ki vin apwan, bay sa yo disponible, gen tout moun sa, tout professionnel sa yo, tout docteur sa yo la pou vin répondre question pour gratis ti chéri. Le gen programme kon sa, point avantage sou yo, paske yo la pou aider nou. Amen? Amen. All right. Thank you so much, Mernell. So we're going back to Mrs. Asmandi Jean. All right. So how can family therapy help with parenting challenges and blended families? If you...
Okay, so therapy can help a lot with families, especially for kids. It helps for a lot of the parents feel like kids don't have challenges. Gan pil parents qui pense passer ti moun ale l'école la kay l'église, y pa gen problème, m'bal diri, m'bal chicken, pa gen problème. Mais gan pil ti moun, especially dans pays ça, qui a souffri mentalement. Ti moun nan ka la devant ou, la questionner est-ce que m'ta doué là? En puis y ka la devant ou, l'autre ti moun nan l'école a bouleversé li. There's a lot of teens, a lot of young children that are battling mental health issues, that are battling depression, anxiety, and anxiety can show up with racing thoughts. Am I enough? Am I smart? Can I do this? Why do I keep failing these math tests? Why doesn't anybody want to talk to me? You notice that your heart starts to race. You notice that your hands get sweaty. You notice that you have a difficult time just functioning in your day-to-day in your class activities. Depression can show up I'm sad, I'm hopeless, I don't even know why I'm here. Why do I have to keep coming back to school? Why does my parents not understand me? And then you start to lose hope in doing things in general. And you may have suicidal ideation where you question your thoughts, you question why am I here? You start to see what would life look like without me? My parents don't really need me. And pour me dire en créole, grand pile Timon, ou est Timon nan, kel te content, qu'on y a ouais, il était dans chambre. Ou est qu'on a mangé, qu'on y a ouais, pas il redri sous manger. Ou est l'on parle avec lui, il pas douanier, il était doucement pour même ou penser c'est respect, mais Timon nan mentalement, il pas là encore. Qu'on y a Timon sa yo, ou en pile Timon qui a mouru, qui a suicidé tête yo, parce qu'il a questionné en pile. En pile mentalement, pression que l'école y a bayo, il pas facile. A lot of schools fait Timon yo prend 3 tests par année. Là yo entre dans décembre, dans mai. Là yo fini y a bayo l'autre examen, en pile les Timon n'a pas passé examen, professeur parle avec lui. Il gagne pression dans l'école, il gagne pression la caille, il gagne pression à amis, en plus il pas connaît qui gens pour l'agir. En plus pour faire plus mal pour ti moun qui haïtien, gagne dès qu'il ti qu'elle a pas prendre. Avec ou la pas prendre tout ça montrer li dans qu'il ti haïtien qui bon, en plus dans l'école là, c'est qu'il ti américain, y a montrer li. Problème qui vini, ti moun sa yo, moi même passer là-dedans, il vient difficile. Parce que parents ap dit A, l'école l'ap dit B. Qu'on y a pour apprendre tout ça, plus l'école, plus l'église, plus famille. Il vient faire si mon senti li pas capable. So il très important pour chita pour faire dialogue avec Timon. Soit Timon bouleversé en pile, vinn joindre nous ka aider ou. Moi-même travaille avec Teen especially pour m'aider pour yo ka apprendre manage tout bagay parce que Jean bagay yo te konye avec konye là il très difficile. So it's important pour apprendre pour chita dialoguer avec petit tout on peut pas seulement demander comment l'école là est-ce que tu fait a chita parler avec lui demander lui qui gens amour parler avant est-ce que gon ti moun ka bouleverser dans l'école là est-ce que ou a questionner tête tout demandez-lui question parce que gene fois Timonio yo smart yo connaît tout ça pour yo dire pour ka juste quitter yo en port comment l'école là était bien oui mami ou t'es passé examen me fait en puis après ça on dit mes amis ganon bon Timon moi gain en puis Timon a souffri mentalement so il très important soit Timon en puis soit pas gain patience pour lui voyez-li into therapy. S'il dans l'église, s'il gon leader, fait leader à chita parler avec lui. Parce que les ti moun n'a pas joindre un monde qui weli, li commence à quitter ses pays, mauvais amis, Instagram, tout bagay sa yo, k'ap montre li, valè li, ou pas vle ça. So bien aimé, s'il vous plaît, moi-même sensible pour ti moun en pile. Nous weyo, nous pas comprendre, nous pas comprendre pour qui ça. Gede fois ouais ti moun fâché pour sans raison et pas fâché, il pas connaît qui gens pour le contrôler. So soit elle comme ça, chita parler avec lui, soit pas capable mener l'église, si l'église a pas ka aider lui, vinn joindre nous, n'a pas aider lui. So nous souhaitons que nous prenions ça puis prier pour lui, prier avec lui, chita avec lui, demander comment il kembe mel, prier avec lui. Pas parler tout lui. Pas juste dire ça pour le faire, mais Kembel, mon petit Jean, ou pas même Jean, non, on nous prie sous dépression. Pour le cas où qu'on remène, qu'on aide lui. Bon Dieu béni nous.
Thank you so much. Awesome. Okay, so beautiful. So much to learn, so much to take in. I pray that you guys were taking notes. We're going to have to conclude the questions for the panelists at this time so that we can give the audience a chance to ask questions. So, moment sana bon pour capable demander panélistes là qu'il y a n'importe question que ou ta vle pour yo elaborate. I had a few requests earlier. So we have the mics here. We have one mic here. You capable aller dans mic là et demander question à panélistes là. Est-ce que nous avons une question? Pas une question? go ahead and go. The first question, Vivos, you had one. Let's go.
Good afternoon. Well, good morning. I just wanted to go back to the gentleman regarding Maggie. You spoke about why we should not, well, you just said that Maggie is bad, but can you explain why it's bad, what's in it? Many people, when they speak to our population, they just say it's bad, but they don't really break down what is in Maggie, why is it bad? So if you can please explain that for us.
Ça, c'est une belle question, and thank you so much for elaborating or asking for more clarification. So Maggie has monosodium glutarate, that's one. In addition to that, it also has large amounts of sodium, salt, right? So salt causes our body to retain fluid, it causes our body to retain water. It then causes our blood pressure, right, to rise, and sometimes that blood pressure can rise and it can become to the point where it's uncontrollable. Right? So Maggie en son bagay ki gen un pile sodium là-dedans. Sodium ça lié, c'est sel. C'est sel qui lié. OK? Et le nous mange un pile sel là vient cause que qu'on nous reteni un peu de l'eau. Le nous reteni trop de l'eau, tension vient monter. Même les yo ba un médicament pour contrôler tension pas contrôler. On l'autre bagay que Maggie gen là-dedans qui c'est un poison. M'dou, moun yo qui fait Maggie, yo pas prendre pour tête, yo pas manger pour tête yo. Yo pas bay petit yo. Yo pas bay madame yo pas bay zami yo, même yo pas consommer, tandis que y a vendre Maggie qui sont poison. Gon bay qui là dans qui les monosodium glutarate. Bah ça une cause que tension vient monter. OK, qu'on a même là prend médicament, tension vient pas contrôler, c'est un poison que lié, un poison, un diable en personne.
Can you give us a little bit of English on that right quick with the Maggie?
Yeah, again, you know, it's a poison. You know, it contains large amounts of sodium. The quantities of sodium that you have in one bouillon cube is enough for a year's worth of sodium, right? Our body wasn't built to handle that quantity, that type of sodium, as my brother and doctor nutritionist can attest to.
Thank you so much, Dr. Dennis. Next question, please.
I don't have a question, but once again, thank you so much to our lovely panel of healthcare providers. But in addition to what Dr. Rimsky mentioned about MSG and the Maggie, which is something that is prevalent in our community, nous aimons Maggie, nous aimons manger goûter bien. I would like to ask Jeremy if you can provide us with some alternatives. M'kwe li vraiment important, le nou di moun yo, nou pa ka manje bay sa yo, oh, this is not good. Mais ki sa nan communauté a nou ka fè ki diferent de sa que nou ka utilize nan sa nap fè a. So I would like to request our nutritionist to be able to provide us with some examples. If we cannot use Maggie, what else can we use as an alternative when we are cooking that will be beneficial for our health? And yes, yep.
So oftentimes, when we use Maggie or anything with sodium, gele fale nou di manje ba bon, li manke sel. Yeah, it's because it's like it doesn't have flavor. We say, and usually when we say we correlate flavor with salt, and that's usually the wrong way to think of things. It's the wrong. Nou ba se pense de sa non mentalité sa. Le manje li ba gen go, li ba gen sel. Gele fwa nous pas manger jan lié naturellement. Like one of the things are what they teach us in school. Gelen fa nous boys just manger jan lié. Like there's times we don't just eat the spinach raw. Like by mettre onion souli, just eat it raw. And quitte bouchou, kembe taste on no bouchou. After a while, le ou fait ça pour 2-3 semaines. Jean manger li different. Like your body's gonna adapt to it. Yeah, so when you start eating food the natural way, après on semaine, 2-3 semaines, your body tends to adapt. So gen fa le ou gen moun ki mange on pile végétable, li ba mettre on pile sel, li commence mettre sel là-dedans, konya li gen trop sel. And it's usually the same amount they used to always put, but now it's too much because their body adapted to a new type of palate. So try to eat things as natural as possible. And you said alternative, you want to just get into seasoning. Now, I say nous bon avec épices, right? Like we really good épices. Li bay on bagay ki mal. You know, when one of the people who are really good when it comes to épices, Indian people, they're really good with their seasoning. So mettez tout bagay l'ail, mettez zognon, mettez tout bagay ça non manger. Mais nous pas besoin mettre trop sel là-dedans. Parce que I did the example last time. Le roi fait manger, nous mettons sel dans épices là. Après ça, nous mettons sel dans épices là, nous mettons sel dans de l'eau. Nous mettons sel dans de l'eau, so quand il y a bouilli, ou mettez sel dans épices là, ou mettez épices dans pan. You frying the épices, right? Quand il y a ou mettez riz, ou mettez poivre, whatever, de l'eau a bouilli, quand il y a ou mettez sel encore. Après ça, sazon, nous mettons sazon. Tout bagage qui gagne en pile en quantité de sel là-dedans. Après ça, il faut nous finir manger. Quand il y a nous sauver, we serve the food, et puis il manque sel. Quand il y a nous mettons sel en troisième fois. So, quelquefois, we need to just manger là naturellement. Put a lot of herbs, spices, a lot of épices in it, sans sel. Et si vous voulez mettre sel, tant manger arrivé, mettez un petit épice, just sprinkle it on sel, that's it. Ou pas besoin mettre sel dans épices, ou pas mettre sel dans de l'eau, just tant manger en fini. Tant manger en fini. Et puis comme ça, liquide, qu'on y a qu'à mettre un petit sel là-dedans, si vous voulez. Mais it's very important parce que nous Haïtiens, nous noirs, nous pas besoin de sel en pile. There's other cultures of people that might need more sodium than us, but for us being Black American, Haitian people, or Caribbean people, just the way our bodies is, we don't benefit off that much salt. So culturally, it's not a huge benefit for us. But for other people who are Caucasian, they might need a little bit more sodium than us. That's why you see prevalence in hypothyroidism and stuff like that. But that's another conversation.
Okay.
But yes, that's the answer.
Thank you, Brother Jeremy. You guys are satisfied? Okay, but we're going to have an elaboration.
I just wanted to elaborate on that as well. When I talk nutrition, especially to my oncology patients, where they have change in their taste bud as a result of the treatment that they're receiving. So what happens, they no longer are able to tolerate the high level of seasoning that they're used to. So we talk about reducing so that they can tolerate it during treatment. And what happens is those patients after treatment, they can no longer tolerate that level that they used to. So you can change those things. You can change your taste buds. And also another thing, what's happening with our culture, why we feel we need all of this excessive salt and seasoning is because we overcook the vegetables, so it loses the nutritional benefits, the taste to it. So ça qui arrive nous dans culture haïtienne, nous ka changer taste bud nous parce que si vous habitué, c'est comme ça manger en supposé goûter, c'est tout ça yo, so c'est ça normal pour nous. Mais ou ka commencer diminuer, dans première semaine nan, il ka difficile pour ou ka manger ça pas bon. Mais l'on fait un changement dans le corps ou continue à habiter pour un minimum de 21 jours. Sous les changements qui lastent, qui restent, fait changement habituellement pour 21 jours ou après le corps commence à répondre à ça, changement fait as the new norm. So, si vous commencez pour 21 jours, ou diminuer, ou retirer maggi, ou retirer toute épice, ou passer tellement cuit végétable, parce que l'eau bouillie, ou retirer goût végétable là-dedans, parce que vous cuit ou retirer benefit nutrition qui dans végétable là-dedans, parce que vous cuit trop. Des végétables, c'est juste chaud, ou besoin chaud. Il n'y a pas besoin bouillir, cuit trop, tout fait, tout ça nous fait. You know, ou retirer goût, so qu'on y a ou fin retirer goût naturellement bagay lan et puis ou ajouter goût chimique là-dedans qui affecter corps. So naturellement et végétable blanc manger déjà gain tout ça besoin. So ou faire ça pour 21 jours, qu'on y a là après dans next mois ou après ajouter même quantité sel ou te qu'on fait avant changement ou après li trop pour passer corps vient habitué avec un new normal. So essayez ça. Nous tout gain possible pour changement. So qu'on fait, il pas besoin de continuer. Lorsqu'on a plus d'informations, ou qu'à faire changement et puis ou après quoi adapter avec nos changements.
Thank you, Manel. So, combien je l'ai dit pour... Oh, ok. Est-ce qu'il y a l'autre question? Est-ce qu'il y a l'autre question? Si pas il y a l'autre question, hein? Allez dans le micro pour un, s'il vous plaît.
This is my last question, I promise. What is the spiritual aspect behind what you guys are teaching us, please?
Okay, yes.
Well, from my personal experience, the spiritual aspect of health and wellness is because God calls us to be good stewards of your blessings. My ability to wake up every morning, open my eyes by myself, I can get out of bed by myself, go to the shower, brush my teeth by myself without anyone having to do any of that for me. I consider this temple my blessing. So any blessing, no matter how small it is, if you're a good steward of it, you will be blessed with more. So because, and I don't take any blessing for granted. So that's the spiritual aspect. So if you're a true believer and feel that God himself created you in his likeness, this is as perfect as it's going to be. Spiritually, I cannot take it upon myself to abuse it or mistreat it.
Thank you, Manel. She said it all? Okay, okay. Thank you so much, yes. That was a great question.
So I wanted to add to the nutrition part.
yes.
Gan pil moun parfois nou néglige ça nous mette dans bouche nou. So our oral health is so important that when we have to brush our teeth twice a day. So I know I'm a pediatric dentist, but I see older kids as well too. We have to floss, we have to use mouth rinse. So, le nou pran pil medikaman, le nou gen symptom tankou le nou gen maladi kèr, le nou gen diabetes, bagay sa yo aji nan bouch nou, kote li vin prodü yon sant. So, an pil moun pa kompren sa, lo gen sant nan bouch nou, se paske gen yon problem. Nou oblige al kay dentist pou yo ka netwaye dan yo genciv yo, le yo komanse fe san, li sa pa normal, paske sa komanse lead to another problem that can be very difficult to manage. So that's why even with our kids, certain foods like the Takis and the hot Cheetos, don't give them to the kids. I have examples.
Oh, she got the example. Okay.
Not my bag.
Okay.
So tankou gen pil parent kap bay timon yo soda, bagay yo pa bon. You have to drink water. Water is the number one thing. Epi tou, hot Cheetos, bagay sa yo sispan bay timon yo, bagay sa yo pa bon. Kids that are sitting here, guys, these things are not good for you because it affects the gums of your mouth. So that's why it's very important. And puis, tout pour ajouter on the mental health, les parents yo, le nou pa chita pale avec Simon yo, mwen wè an pil Simon, a lot of patients that they're in divorce homes, parents are separated. So nou vin pa kopwen, Simon sa yo parfois yo neglige koyo, they don't want to brush their teeth. Especially around COVID time, I had a lot of teenagers that would come in, their mouth is filthy because they don't have parents to sit down and talk to them, nobody to have that open dialogue. So it definitely all leads to mental health. So I'm just happy to just be here because I'm listening to everybody else, but it all ties down to the oral mouth because I see this on an everyday basis. And sometimes it's so sad. I have teenagers that are oral sex with my young babies, and parents don't know this. Even communauté haïtienne, gen pil haïtien, yo pa pale avec timoun yo. You have to, because gen pil fwa nan l'école yo, they're giving them candy, they're giving them all the unhealthy snacks, but yo pa checke the book bag. Look inside the book bag, look to see what the kids are bringing home, because these things do affect overall. Thank you.
Yes. Ooh, I want to elaborate, but I got to keep moving. Okay.
Can I?
Yes. Go ahead.
2 minutes?
Yes, Dr. Rojas.
In regards to your nutrition too, because the incidence of colon cancer is going up in younger patients, okay? And we think that it's an environmental factor, especially the things that we're eating, the ultra-processed foods. I mean, just like you're saying, you know, I had last year a 29-year-old with colon cancer, okay? 35-year-old, 45-year-old. I mean, these are patients that are too young, and it starts at a young age, right? Making sure that we're eating the right things and not these ultra-processed foods, like you're saying, you know, sodas, things like that.
Oh, yes, Dr. Rojas, that was, yes, okay, Brother Jeremy. Okay. Okay, your wife first, okay.
Right. Hello, everyone. So, two things. When you were speaking about high blood pressure and the intake of salt, can you also speak to the opposite end that I deal with, folks that have low blood pressure? So my parents had high blood pressure, so they would take salt out of everything, and I would get dizzy every time I ate because they didn't understand that I experienced a lot of low blood pressure. So can you speak to how to moderate a house where you have both? And then can you also speak to how to identify the foods that we shouldn't give our children? Like maybe 3 things at the grocery store, what to look for on the back of the packages that you're purchasing if you have to buy a package, because I know it's better to just buy real food.
Who is that question? Anyone can answer that, definitely. The low blood pressure, Dr.
Thank you so much for that question. Yeah, I'll defer the nutrition question to another panelist who's more skilled or versed in that area. But I would say that the hypotension or the low blood pressure issue, it's not as common, and particularly in our community, as hypertension. That being said, if someone does have low blood pressure, they may actually need to have an intake that is a bit higher in sodium, right? But again, that's done on a case-by-case basis. I would say for the majority of people, at least for the majority of patients that I see, their blood pressures are significantly elevated. Like last week alone, I lost count of how many patients that I saw with blood pressures in the systolic 180s, 190s, and several in the 200s. And these are individuals who are walking around normally, have no issues, they have no symptoms, because oftentimes in our community, the absence of symptoms means the absence of disease, which is extremely problematic. And it's very challenging to convince our patients to do something, or people in our community to do something, if they feel well or if they don't have any symptoms. It's very challenging to convince them to take a medication every single day if they don't have symptoms. En pile fois dans communauté pa nou, pi fò nan moun ke nou wè, se des moun ki gen tension nan systolique nan 190, 200, li pa bon du tout. Et li difficile parce que en pile nan moun sa yo senti yo bien, yo di m'pa gen problème, m'pa gen symptôme, m'pa gen ken douleur, m'pa besoin pour médicament. Malgré ou pas gen symptôme, malgré ou pas senti ou gen rien, les tensions comme ça, li pas bon. Li mettent à plus, il a plus chance, plus risque pour faire crise cardiaque, pour faire stroke et pour faire un de l'autre maladie, pour gagner un problème avec rein. Li pas bon du tout. Et c'est un problème, nous besoin freiner le problème ça le plus vite que possible.
Awesome, thank you. Okay,
George got.
I just wanted to add before we move on. So in the context of hypertension, low blood pressure, my father died 25 years ago, September 2nd, 257 high blood pressure. He was 57, smaller than me, and had no symptoms until the day before.
Silent killer.
And I was hypotensive. I was 21 at the time, so I just said my age. And the prescription for me was eating healthy and exercise, not more salt for me. And also still today, thankfully, I'm still hypotensive, and I still don't increase my sodium because of my family history and the risk of hypertension in my family. So lots of young people are dying in my family that don't have symptoms, and they just drop dead, all the men. So for me, it's for many of us, it's exercise and moderate diet. And the dietitian will talk about the ultra-processed foods, but it's very important to think about, as Dr. Denny said, the symptoms, not having the symptoms, but getting checked.
Thank you, Dr. George.
Yeah, and usually, oftentimes when you think of people who are hypotensive, like their blood pressure is low, definitely you want to see moderate, like, okay, where are their sodium levels? But there are other factors that affect the blood pressure as well. Like, so we think about your potassium intake, your magnesium intake, also your calcium intake. You know, there is a strong correlation between potassium and sodium. So sometimes you might see a correlation where the potassium levels might be high. So there might be some type of moderation in fruits and vegetables, because usually in fruits and vegetables there is a high level of potassium. There is going to be some moderation in the sodium intake. It might not be high. It might just say stick to the recommended amount, but it won't be like, hey, you should have a high sodium intake. So there is that, and then so we want to make sure we're doing that. And then if it's in some cases, depending on the individual, we want to be we're going to probably have that person see a specialist if we see if it's a little bit too severe. And that's where a physician needs to get involved. But usually there are those things you want to look at. The magnesium, about 50% of American population are not getting enough magnesium. And usually get magnesium from the fruits and vegetables that come from the ground. So that comes out of the soil. So this is good healthy starches like potatoes. You know, even what you get a good magnesium, you'll get it from avocado as well. Haitians love avocados, so we want to make sure we're getting a good amount of avocados in our diet as well. But then also, like I said, potassium and calcium. Oftentimes we don't get a good amount of calcium in our diet, so we want to be mindful of that. Sometimes our calcium is canceled because of food interactions, like simple things like, for example, if I eat cereal, right? And calcium and iron when they hit together, they block out each other. So sometimes you have this interaction where the cereal has like calcium and iron, and then the milk has calcium, and there's a food interaction. Now you cancel out both, so you don't get the calcium for the food, and then you don't even get the iron. So sometimes little things, I always tell people, hey, you might want to just have the cereal separate and then have the milk separate itself. If anything, please just don't have cereal at all, because it's processed. I'd rather you just eat oatmeal. So there's different things that we can do to make sure we avoid those. But like I said, the original thing they're going to be looking at calcium, potassium, and magnesium.
Awesome. Thank you so much. That was great elaboration. We got one more question.
Yes, and I know we are definitely past our time, so I do want to thank you all. But my final question that I would like for you to share, and this is not for everybody on the panel, I think this is a great time, especially in lieu of October, which is Breast Cancer Awareness Month. If some of our providers can share with the audience some of the medical test screenings that we need to start looking at different age stages of our life, when we need to start, checking for, our breast exams, HPV. We have a pediatric dentist as well too. When should we start taking our kids to the dentist, colorectal surgeon? When should we start getting ready to get those colonoscopies done? How often should we get these type of tests done? If some of our healthcare providers can share some of these different medical tests and screenings, and also the different times in our lives and ages that we need to start prepping for them as well too. I think that would be very, very beneficial for us all. Thank you so much.
So like I said, 45 for colon cancer. So you should start getting screened at the age of 45. Usually that's with a colonoscopy, which is a procedure. There are other tests that are appropriate for some patients that don't require that you have a procedure, where you can actually do the test at home. They'll send you the kit and send it out. If your colonoscopy is normal, then it's every 10 years. The good thing about a colonoscopy is that it allows you to also remove any little growths that are there. So you're not just screening, you're preventing colon cancer. Yeah.
Thank you, Dr. Rojas.
As far as breast cancer goes, like I said, it's really about early detection. One of the things that I'd like, unfortunately I have to go to another panel in Coral Springs at 1 o'clock, but my colleague here, Hillary, will be able to demonstrate. I really encourage every woman, and remember, breast cancer is not just women. Men get breast cancer too. It's at a much lower, incident, but men get breast cancer too. I really want to encourage women, young ladies, to start doing the breast self-exam every month once they start the menstrual cycle, whether that's 9 years old, 10 years old, 12 years old. Start doing your breast self-exam, because what that does is, this is at the most baseline. If they do it properly every month, you get to know what the baseline, what your normal breast feels like, look like, so that the minute there's any changes, there's any abnormality, you will be the first to know. You will bring it to your doctor's attention so they can do a clinical breast exam and then go further onto the mammograms and so forth. Based on the guidelines, it is recommended that women from the age 40 to 45 can start doing the mammogram. Now, even though you do the self-breast exam and you'll be able to identify anything abnormal if it exists, however, the mammograms can identify abnormalities that are there at even an earlier stage before you could even feel it. And again, the goal is to find it, to detect at the earliest, smallest stage for better outcome. And then, you know, after that, if there's any abnormalities, they can escalate to other tests such as ultrasounds, MRIs, and biopsies if needed. But the basic form is to start with the breast self-exam at the young age so that you can know your breast. I recommend doing it either a week before or after the menstrual cycle for people that are of menstruing age. And for those that no longer have their menstrual cycle, pick one day out of the month. I usually say pick your birth date. My birthday is on the 7th. So every month on the 7th is when I will perform my self-breast exam. And also seeing your primary care provider. They manage all of the guidelines. For example, I had, you know, I'm not gonna say my age, you know, I'm at the age now where I had to start doing the colonoscopy. So, you know, it really made me realize, oh shoot, I'm getting old. I'm already at that screening age. So I went ahead and I did it, you know. Breast cancer, I'm at a higher risk because I have family members that were diagnosed at the early stage of 35. So I started my mammograms, not at the age of 40, but I started it at 29 because that's, you know, the first time I found out that I was at higher risk. So because I knew my risk, I had to do genetic testing, and I started my mammograms earlier on, and I have to do it every single year because of the results of my mammogram, and I've been doing that for years now. So, you know, those are the preventative things, and thank God, because, you know, I know that risk, and I'm doing the screenings, I'm doing the checks, I'm sitting here before you, and I'm okay, right? So, you know, different disease processes have different screening. Your primary care should be your very, you know, that's the person that manages your overall health, whatever. Don't miss your yearly screening, because your primary care can guide you as to what guidelines, where your risks are, where you are now as far as additional screenings that are needed.
Thank you so much, Marnell. Anyone else? As far as the age, pediatric dentist.
Yes, by the first birthday is what we recommend, definitely no later than 3 years old. There's definitely something called oral cancer. So oral cancer screenings usually starts at about 18 years old and up. I've had a patient before where it had oral cancer and we had to cut a section, a part of their tongue. So you want to make sure that you stay on top of what's going on inside of your mouth.
Okay, very good. Can I ask you another question regarding the oral cancer?
Mm-hmm.
You said at 18 you start testing. Is that like a protocol that you guys test at 18, or how does that go? Like, do you have to come in and say, hey, I want to be like, because
Yeah, it's part of the routine exam, and just because at 18 you're considered an adult.
So that's why it's important to go to the dentist.
Yeah, and then also too, around that age, there's other recreational activities going on with our teenager groups. Oral piercings is very common, so oral piercings can lead to some other complications that people are not aware of.
Okay, thank you. Thank you so much. Okay, so I think that's it, but we're going to, do you have the gifts for the guess we're going to ask a few questions right quick. Our time is really up, but I don't want m'bavle pour nous aller pour nous pas joindre ti gift nous gain pour nous ti cadeau. So n'a demandé quelques questions et n'a pas si nous t'a pas prendre. Nous t'a pas prendre? Ultimate? Yeah. Okay, there they go.
Yes, so thank you so very much. I would, before we even move forward, I would like to first of all request all of the audience members to give our lovely panel a round of applause. I cannot hear you. A wonderful round of applause. This time that we were able to spend this morning to be able to hear all of this valuable information is something that is priceless. You cannot put money on this. Ça c'est une belle occasion pour nous te chita, pour nous apprendre, pour nous prendre une série d'informations. Nous pas tap ka joindre. Nous connaissons nous aller dans code docteur. C'est 5 minutes yo ban nous pour nous seulement demander questions nous si nous avons question pour yo ouais nous pour nous aller. Mais nous avons une chance yo là depuis 10 heures. Yo gen yo qui même là depuis 9 heures. Yo là yo patient avec nous. Et les fini yo passer tout le temps ça pour yo partager en pile information que nous besoin et yo ban nous chance pour nous demander questions. So nous dit bon Dieu merci pour yo tout. Thank you so very much for your time, all of your knowledge, your patience, and your sacrifice. We thank you guys so much, and may God bless you tremendously. We also want to give a round of applause to our wonderful moderator, Rose Bassett. Thank you for coordinating and guiding us along through this process as we were preparing through our panel discussion. So so we're very excited for that. So I know that the time has gone over, and I know that there are some previous engagements with you guys, but we could not let this time go without sharing our small token of appreciation for you all for being able to be with us. So we're gonna go through this rather quickly, and my lovely assistant, Rose Bassett, she will help guide us along. So first and foremost, we want to say thank you to Minerve Fleur Amé. Thank you so very much for coming. Round of applause, please help me. And thanking you and representing Hannah as well too. Next, we have Dr. Rimsky Dennis. M'pat même connaître Dr. Rimsky, c'était un parcelle payé. We thank Dr. Rimsky. He is in charge of a comprehensive medical center in Little Haiti, so please make sure to reach out to him as well too. We have Dr. Owen Saintville, our pediatric dentist. We're so proud. A very special friend of mine. Nous pas connaître moi-même avec her, nous allons dans même l'école depuis longtemps. Ça sont bons amis. We thank God for Dr. Sabrina Joseph Cherelis, my beautiful friend. Nous pas connaître, mais c'est on l'autre ami. Nous te allons dans UM ensemble aussi. So we thank God for your time.
Thank you.
Next, we have Dr. Maria Rojas. Thank you so very much, Dr. Rojas, who has given us a lot of valuable information about our gut health and our colon. So thank you so much.
Thank you.
Next, we have Dr. Sophia George. Thank you so much. She is in charge of the George Lab at the University of Miami. Very knowledgeable and our fellow Caribbean sisters. So thank you so much. Yes, very good. Next, we have Dr. Caslan Bellefleur-Jules. She is our fellow FPU friend. We're so very proud and happy to have you with us this morning. Thank you. We have Asmandi Jean. Wow, wow, wow. I don't think we realize how important mental health therapy. C'est un bagay nous pas parler souvent dans culture haïtienne. Jean li important pour nous parler avec monde dans une série de bagages qui affectent nous mentalement. Il est vraiment important pour nous parler. Il y a une partie pour nous spirituel, pour nous prier, pour nous parler avec l'autre monde. Mais il est vraiment important. Bon Dieu mette monde sous route nous pour aider nous. Là nous avons une série de problèmes que nous avons traversés. Professionnels côté nous capable parler avec eux. Les fini c'est chrétien, on pas connaître si nous t'étend de lui prier avec Timon yo tout, oui. So c'est vraiment important li bay aspect pour nous spirituel et aspect comment pour nous gérer tête non dans bay mental. So nous disons bon Dieu merci pour vous. Next we have our very own Jeremy Etienne, our nutritionist. We thank God for him who came with the whole squad, his beautiful wife and his children. And we thank them so very much. And last but not least, we have to give a special thank you to Rose Bassett. I see she's running away. Rose Bassett. We thank God so much for you. May God bless you. So once again, thank you so very much. Another round of applause. We are going to, currently at this moment, we're going to ask our panelists to please go to the back. We have something prepared for you all. Thank you once again. And then nous demandé tout le monde qui pas derrière nous devant, nous pas passer par derrière, nous gain lunch qui préparé pour nous tout qui là. Et nous continuer avec tout cadeau, petit cadeau, n'a pas testé nous dehors. N'a demandé questions, nous toujours gain l'autre bagaille dehors qui planifié pour nous tout. Que bon Dieu bénisse nous.
m'ta souhaité ça te un bon moment pour nous. Est-ce que nous te apprenons en pile? M'apprendre en pile aussi. Et nous entendons ça, mon yo dit, faut que la ta doit plein monde. Mais même si l'autre moun yo pas là, nous-mêmes nous joignons manger. C'est pas vrai? Que bon Dieu bénisse nous, nous mettre passer par derrière.